Welcome to our channel, where we share knowledge and solutions to help enhance health and improve the quality of life. Kidney stones are not just a health issue, but also a painful and uncomfortable nightmare. Did you know that some kidney stones are so large they require emergency hospitalization and extended treatment? In fact, kidney stones have become one of the most common causes of excruciating pain for millions of people worldwide. However, not everyone fully understands the real causes behind them. These stones do not appear randomly, but are the result of a series of factors within the body, from diet to hydration levels. And while they may start small, once they form, kidney stones can cause severe damage to vital organs. You will certainly be surprised to learn about effective prevention and treatment methods that not everyone is aware of. In this video, we will provide you with important knowledge to help protect your kidney health and prevent the formation of dangerous stones. 1. The formation of kidney stones. The largest kidney stone ever recorded weighed more than 1 kilogram and had a diameter of 17 centimeters. The patient did not actually swallow a stone the size of a coconut. Kidney stones form inside the body, but unfortunately, they are extremely painful when being passed out. A kidney stone is a hard mass formed from crystals that can appear in the kidneys, ureters, bladder, or urethra. Kidney stones form when compounds in the urine, such as calcium, oxalate, uric acid, and phosphate, accumulate and crystallize. When these substances are not expelled in time, they continue to grow and gradually form hard stones. This process begins when urine becomes concentrated. If the body is not properly hydrated, these compounds cannot dissolve and begin to clump together. When the pH of the urine changes, such as becoming too acidic or too alkaline, the likelihood of kidney stone formation increases. These initial crystals may not cause symptoms, but as they grow, they will become larger and turn into kidney stones. The formation of kidney stones not only depends on the concentration of urine, but also involves chemical changes in the urine. When chemical compounds like calcium combine with oxalate or phosphate, they can form hard crystals, and if not removed in time, they will gradually develop into stones. This process can take from weeks to years without any clear symptoms. When the stone moves through the urinary system, it can cause severe pain and scratch the ureter, leading to bleeding. Larger stones can cause blockages, reducing or stopping urine flow, leading to infections and serious kidney damage. The formation of kidney stones occurs silently, but as the stones grow and move, they will cause significant health problems if not detected and treated in time. Understanding the process of kidney stone formation is crucial for timely prevention and treatment, helping to protect long-term kidney health. 2. Types of kidney stones. Kidney stones are not just one type. They come in various forms, each forming from different substances in the urine. Understanding the types of kidney stones will help you identify and treat them more effectively. Below are the most common types of kidney stones. Calcium oxalate stones. This is the most common type of kidney stone, accounting for about 80% of all cases. Calcium oxalate stones form when calcium in the body combines with oxalate, a compound found in many foods. Although calcium is an essential element in the body, when it is not dissolved in the urine, it can combine with oxalate to form crystals, gradually developing into stones. Calcium oxalate stones typically appear in individuals with low urine output or those lacking chemicals that help prevent the combination of calcium and oxalate. Calcium phosphate stones. This type of stone is less common but still represents a significant portion of kidney stone cases. Calcium phosphate stones usually form when the urine is alkaline, which allows calcium and phosphate to combine and form crystals. People with metabolic disorders or kidney-related conditions are at higher risk of developing this type of stone. Uric acid stones. Uric acid stones form when the level of uric acid in the urine becomes too high. Uric acid is a byproduct of purine metabolism, a compound found in certain foods and also a byproduct of digestion. When the level of uric acid in the body exceeds the urine's ability to dissolve it, it forms urate crystals, leading to kidney stone formation. Uric acid stones are common in people with diets high in purines or those suffering from conditions such as gout. Struvite stones. Magnesium ammonium phosphate. Struvite stones are formed when there's a bacterial infection in the urinary tract. Infecting bacteria can produce enzymes that break down urea in the urine, allowing magnesium, ammonium, and phosphate to combine and form struvite stones. Struvite stones typically form in individuals with recurring or chronic urinary tract infections, and they can grow rapidly and become quite large. Cystine stones. These are rare kidney stones, accounting for about 1 to 2% of all kidney stone cases. Cystine stones form due to a rare genetic disorder called cystinuria, in which the body cannot properly reabsorb cysteine, an amino acid, into the bloodstream, causing excess cysteine to accumulate and crystallize into stones in the kidneys. Cystine stones are more common in younger individuals and may recur multiple times. Recognizing the types of kidney stones not only helps to better understand their causes, but also aids in determining the appropriate treatment method. Each type of kidney stone requires a different approach to treatment, and understanding these stones is a crucial step in protecting your kidney health. 3. Symptoms and pain. When kidney stones begin to move or cause a blockage in the urinary system, patients often experience intense pain. The most characteristic pain when dealing with kidney stones is the renal colic, a sharp and sudden pain that occurs in the lower back or on one side of the body. This pain can last from a few minutes to several hours and is often very uncomfortable, causing the patient to be unable to remain still and constantly move to alleviate the pain. This pain may radiate down to the lower abdomen or groin area as the stone moves through the ureter. In addition to renal colic, patients may also experience a burning sensation during urination, especially when the stone moves down the ureter and irritates the lining. This symptom is often accompanied by a stinging feeling and difficulty urinating. Another important warning sign is the presence of blood in the urine. Kidney stones can scratch the ureter walls, causing blood to flow into the urine, turning it pink or red. In some cases, the urine may become cloudy or have a foul odor, indicating a urinary tract infection caused by the presence of the stone. Beyond the pain and symptoms mentioned, patients may also experience nausea and vomiting due to the severe pain affecting the digestive system. Some people may find it difficult to urinate, having to go frequently, but passing only small amounts of urine, or feeling like they cannot fully empty their bladder, even though they have the urge to urinate. These symptoms need to be taken seriously in order to detect and treat the condition early, preventing severe complications such as infections or kidney damage. Number 4. Treatment methods. When dealing with kidney stones, proper treatment is crucial to reduce pain and prevent serious complications. Treatment methods for kidney stones depend on the size, location of the stones, and the severity of symptoms. Below are some common methods used in the treatment of kidney stones. In the case of small kidney stones, they may pass out of the body on their own without the need for medical intervention. This is typically the case for stones smaller than 5 millimeters. To support this process, doctors often recommend drinking plenty of water to help the stone move more easily through the urinary system. Additionally, pain relievers can help alleviate the discomfort as the stone moves through the organs. When kidney stones are larger or cause more severe symptoms, other treatment methods may be necessary. One common method is extracorporeal shockwave lithotripsy, ESWL. This method uses sound waves to break the stone into smaller pieces, making it easier for the fragments to pass out of the body. However, if the stone is too large or cannot be broken up with sound waves, more invasive measures may be required. Another option is surgery. In cases where the stone is too large or cannot be shattered with shock waves, the doctor may need to perform surgery to remove the stone. This surgery may be done through a small incision or via an endoscopic procedure, where the doctor uses a flexible tube with a camera and small tools to remove the stone without needing a large incision. Additionally, a stent may be placed in the ureter to widen it, making it easier for the stone to pass out of the body. A stent is a soft tube placed in the ureter to ensure that urine flow is not blocked by the stone. This method is often used when the stone causes a blockage in urine flow or when there is a risk of infection. For treating specific types of stones, such as cystine stones, doctors may prescribe medications to help lower cystine levels in the urine. This helps prevent the formation of more cystine stones in the future. Overall, the treatment of kidney stones depends on the size, type of stone, and the patient's health condition. Therefore, consulting with a doctor is essential to choose the most appropriate and effective treatment method. 5. Prevention. Preventing kidney stones is crucial to protect kidney health and avoid painful episodes, as well as serious complications. Although not all cases of kidney stones can be prevented, there are several effective measures to minimize the risk of developing this condition. One of the most important factors in preventing kidney stones is drinking enough water. When the body is well hydrated, urine becomes more diluted, helping compounds like calcium and oxalate not to easily crystallize. Drinking at least 2 to 3 liters of water daily will help reduce the risk of kidney stone formation. Specifically, drinking water after meals and when feeling thirsty is the most effective way to maintain stable urine volume. In addition, controlling your diet plays a significant role in preventing kidney stones. Limiting foods high in oxalate, such as spinach, beets, and nuts, can help reduce the risk of forming calcium oxalate stones. However, this does not mean eliminating these foods entirely. It is important to consume them in moderation. A balanced diet rich in fiber and low in sodium also helps protect the kidneys. Another factor to pay attention to is reducing salt intake. Consuming too much salt can lead to high calcium levels in the urine, which increases the likelihood of kidney stone formation. Reducing the intake of processed foods and salty foods will help the kidneys function more efficiently and prevent kidney stones. Additionally, maintaining a healthy weight and avoiding obesity also play an important role in preventing kidney stones. Obesity increases the risk of metabolic diseases and also raises uric acid levels in the body, which is a cause of uric acid stones. Regular exercise is another key factor in maintaining overall health and preventing kidney stones. Physical activity improves blood circulation and enhances kidney function, helping to prevent the formation of crystals in the urine. Finally, regular health checkups and monitoring your kidney health is an effective way to detect early issues that could lead to kidney stones. Particularly for individuals with a history of kidney stones or metabolic disorders, frequent health screenings are important for early detection and timely treatment of symptoms. With the information shared, you now have a better understanding of the causes and prevention methods for kidney stones. Apply these tips now to protect your kidney health. The sooner you become aware and take action, the more you can avoid unnecessary pain. If this video has been helpful, don't forget to subscribe to the channel so you won't miss our upcoming videos. Share it with your friends and family so they can also learn how to protect their kidney health. And don't forget to turn on notifications to receive our latest videos. Thank you for taking the time to watch. Wishing you good health and happiness.